So we put the patient to sleep, inject with local anesthetic, which constricts the blood vessels. That takes at least 10 minutes to work. So this time I use this to teach. Normally I torture my fellows and make them analyze the nose as I criticize or critique what they say, but this time I'll just do the nasal analysis. We look at the frontal view. The dorsum, the top third of the nose, tilts off slightly, almost to her left. Then the middle vault and the tip goes to her right. Bones look good. Then she has a drop off, narrowing of the middle vault on both sides, and a rounded nasal tip. You can see she has facial asymmetry. The mouth is tilted this way, and the tip actually follows the angle of the tip. So this is the long side of her face, short side of her face, and the nose follows that curvature. We just had a publication confirming this. On profile, she has a tiny dorsal hump, slightly full super tip. She wants a super tip break. The angle is about 95 degrees. She wants slight rotation of the nasal tip. On smiling, the tip does not pull very much. The lip pulls up a little bit, but not a lot to do with the smiling view. And one of the things she said is my nose looks different from different angles. It's because it's crooked. You can see here, since the top goes slightly to the left and the middle third back to her right, the bump is bigger and the tip is broader. From the other side, the bridge looks straighter. This is her preferred side. Also, you can see the wide nasal tip. From below, which is called the submental view, the tip angles to her right, but something that contributes to that, again, is a skeletal asymmetry. You can see that this nostril attaches further out than this nostril. This is her flat cheek. This is her more prominent cheek. So the nose actually attaches deeper here, which helps to make the nose tilt. Next, on the face down view, we can see again the bones actually almost the midline, even almost slightly right, and this goes more to the right and then straightens out the nasal tip. So we want to use this view correlating with the frontal view. So you've almost got this almost an S-shaped bridge. So in front of view, we start from the top down, the bony dorsum, the top third. Midline is slight to her right. The middle third tilts more to her right. The tip right, but slightly straightens out. She has a step off here in the middle vault where the upper lateral cords attach underneath the nasal bones. And you can see the angulation of the base of the nose parallels her mouth. Everybody has this type of asymmetry. This is the long side of her face. This is the short side of her face. The nose curves and follows the curvature of her face, which we actually just recently published, showing that's a common correlation. So it means that the angulation or crookedness of the nose is more related to natural growth rather than history of trauma or nasal fracture as a child or during sports. So this